Social Pragmatic Communication Disorder, SCD, and Autism Spectrum Disorder, ASD, can be challenging to distinguish as they share overlapping symptoms. However, understanding the differences between these two disorders is essential for ensuring an accurate diagnosis, appropriate treatment, and support for affected individuals. Social Pragmatic Communication Disorder versus Autism Spectrum Disorder. Social Communication Disorder, SCD, is a neurodevelopmental condition recognized in the DSM-5, or Diagnostic and Statistical Manual of Mental Disorders, 5th edition. Individuals with SCD face ongoing challenges in social interaction and communication. SCD involves difficulties using language for social purposes, like greeting others, sharing information, and understanding social cues and rules. It's diagnosed when these issues aren't explained by another condition like autism spectrum disorder or intellectual disability, and it doesn't include repetitive behaviors or restricted interests found in autism. Autism spectrum disorder, ASD, is a neurodevelopmental condition featuring social communication challenges, repetitive behaviors like hand flapping, and sensory sensitivities. Unlike social communication disorder, ASD entails a broader range of symptoms, necessitating different diagnostic and treatment approaches. Identifying the overlapping symptoms. One of the reasons it's tough to differentiate between SCD and ASD is the presence of overlapping symptoms, such as difficulty understanding and using verbal and nonverbal communication cues, such as body language, facial expressions, and the tone of one's voice. Difficulty following social rules and conventions, such as turn-taking in conversation and making eye contact. Difficulty using language in a socially appropriate manner, such as understanding sarcasm and humor. Difficulty making and keeping friends. Difficulty interacting with others in social settings. These similarities can make diagnosis challenging, and professionals must carefully assess each case to determine the appropriate diagnosis and intervention. Here are some specific examples of overlapping symptoms of ASD and SCD. A child may have difficulty understanding and responding to social cues, such as facial expressions and body language. This may lead to them saying or doing things that are not appropriate for the situation. A teenager may have difficulty making and keeping friends. They may not understand how to start and maintain conversations, or they may have difficulty reading social cues and understanding the intentions of others. An adult may have difficulty interacting with others in social settings. They may feel uncomfortable or anxious in social situations, and they may have trouble understanding and responding to the social cues of others. Key differences between SCD and ASD. Verbal and nonverbal communication. To differentiate between SCD and ASD, consider the severity of verbal and nonverbal communication difficulties. ASD individuals typically have more severe challenges in both areas compared to those with SCD. Additionally, ASD individuals often exhibit restricted and repetitive behaviors, while those with SCD do not. Diagnosis relies on multiple factors, including communication abilities, presence of repetitive behaviors, and developmental history, rather than a single test. Social interaction challenges. Social interaction challenges are shared between SCD and ASD, with both conditions causing difficulties in initiating and responding to social cues. While ASD involves repetitive behaviors and sensory sensitivities absent in SCD, individuals with ASD may also struggle with nonverbal communication, intensifying social hurdles. Additionally, ASD typically presents more severe social interaction challenges than SCD. Recognizing these differences is crucial for accurate diagnosis and tailored intervention. Diagnosis considers multiple factors, including social interaction skills, repetitive behaviors, and developmental history, rather than relying on a single test. Repetitive behaviors and sensory sensitivities. Repetitive behaviors and sensory sensitivities are key distinctions between ASD and SCD. In ASD, individuals may exhibit behaviors like hand flapping, rocking, or repeating words phrases, which are not present in SCD. Additionally, ASD individuals can be overly sensitive or underreactive to sensory stimuli like sound or light, unlike those with SCD. These characteristics differentiate ASD from SCD. Diagnostic criteria. The DSM outlines diagnostic criteria for both SCD and ASD, facilitating differentiation. SCD diagnosis centers on persistent verbal and nonverbal communication challenges impacting various life domains. In contrast, ASD diagnosis requires additional symptoms like repetitive behaviors and sensory sensitivities. This differentiation aids professionals in accurately identifying and addressing each condition's unique needs. Treatment approaches for SCD and ASD. Treatment approaches for SCD and ASD often include speech and language therapy and social skills training, tailored to each condition's specific needs. Speech therapy focuses on improving communication skills and social understanding. In SCD, it targets pragmatic language skills, while in ASD, it addresses broader communication challenges, including nonverbal cues and conversation skills. Social skills training, facilitated by various professionals, teaches appropriate social behaviors through peer interactions and social stories. Working collaboratively, professionals, parents, and educators ensure consistent support for individuals with SCD or ASD to develop their social communication skills effectively. How connected speech pathology can help you. Connected speech pathology's experienced SLPs assist individuals and families in navigating the diagnostic process and gaining a thorough understanding of these conditions. We provide clarity and support to ensure tailored interventions for unique needs. Through comprehensive assessments, we differentiate between disorders and offer guidance toward improved social communication skills, enhancing overall quality of life, regardless of whether the challenge is SCD, ASD, or a combination thereof. Differentiating between social pragmatic communication disorder, SCD, and autism spectrum disorder, ASD, can be challenging due to their overlapping symptoms. Yet, understanding these distinctions is crucial for accurate diagnosis and treatment. With collaborative efforts and effective interventions, we can empower individuals with SCD or ASD to enhance their social communication skills and confidently navigate social situations. Together, we make a meaningful difference in their lives. To learn more about therapy options for SCD and ASD, visit our website today at www.connectedspeechpathology.com. Let's work together to support and empower those affected by these conditions, ensuring they thrive in their social interactions and lead fulfilling lives.